Hi, I'm Dr. Daniel Hoover with Beach TV's Tai Chi for Beginners. And this segment is the truth about chiropractic. You're going to learn today about why chiropractic is essential to your healthcare. You're going to witness a chiropractic adjustment and see just how safe it is. So what is chiropractic? It's a drugless healing art. Doctors of chiropractic are trained in diagnosing and treating the nervous system, the spine, and the musculoskeletal system by using hands-on techniques to adjust and restore alignment, proper mobility of the body, and most of all, enhance the body's natural ability to heal. All of that without drugs or surgery. Let's get started. A lot of people ask me, when do I go see the chiropractor? And my answer is now. Why wait for pain? Now, most people come in because they have low back pain, neck pain, headaches, and yes, those are common conditions that we help treat, but we really want to prevent the pain and the degenerative processes like arthritis. I want to explain to you briefly, how does chiropractic work? Well, as you know, our brain sends signals down the spine and out these pairs of nerves. And anything downstream from one of these nerves can be affected. In life, we have bumps and falls, we sit at a desk, and we have stress, and that can shift one or many of these vertebrae out of alignment, causing pressure on one of these nerve roots. And so what a chiropractor does is assess where is there a subluxation or a misalignment causing irritation on one of these nerve roots. And what we find is that just next to one of these fixations, there'll be muscle spasm or pain. So we'll adjust it, and that'll be like flipping on a light switch and immediately giving 100% of nerve impulses to that area or that muscle. The muscle may have been spasming and now it relaxes. This is how people have an immediate relief with chiropractic. But wait, there's more. The reason why people keep coming back to chiropractic is because of the happy side effects. So you know how I said everything downstream from these nerves can be affected? Well, if there's a misalignment in the neck and those nerves go to the shoulder, but also down to the hands and fingertips, the numbness and tingling can go away. If those nerves go to the head and the sinuses, like in C2, the second cervical vertebrae, patients will report, suddenly my headaches are gone, or my sinuses are clearing up. I can breathe through my nose again. And these we call happy side effects. There's no limit to the happy side effects. Most commonly, we'll see women report that their menstruation is improving, less cramps. Seasonal allergies improve because the nerves that come out of the mid-back go directly to the lungs. Also, reproductive health, we notice more energy. So try chiropractic not just when you're in pain or after a car accident, for example, but before, to really give good hygiene and health to your nervous system. I mean, wouldn't you want 100% of the activity in your brain and your nervous system going to all the end organs, the heart, the liver, the kidneys? That's the wellness side to chiropractic. So next, I'm going to demonstrate what does a chiropractic adjustment look like. Before I adjust the patient, I already did an intake. I took the history, we took x-rays here in the back to rule out any contraindications to a safe chiropractic treatment. So Kayla is cleared for an adjustment. The first thing I want to do is locate where the subluxation or fixations are in the spine. So I'm looking for any asymmetry, any areas where the muscle is very tight. Sometimes there's an area that's more hot than another area. But as I go down the spinal column, I might see there's scoliosis, not in this case. Then we're going to check the height of the hips. You ever hear how someone says, I've got a short leg? Well, this is one of the ways we can tell. So I'm checking the height of the hips, and then I want to see how are the hips moving. So this right hip or sacroiliac joint is moving forward easily. Over here, it's a little bit stuck. It's a little restricted. It might look like I'm not doing much, but what I'm doing is I'm pressing on these bumps here on the back of the spine. But I'm also checking these areas here as well to see, is there rotation or not? When I was pressing earlier, I'm just pushing right here to see if the ilium or sacroiliac joint is moving properly. So that's what we're doing, looking for symmetry. And if, for example, down here, L4 and L5 are out of alignment, guess what? That means those nerves are irritated, and she'll have low back pain and maybe even spasm of the muscles. Have you heard of sciatica? This can be a root of sciatica. If the nerve is pinched, it's going to send a signal all the way down the foot where a patient can experience numbness or tingling. All right, I think that's enough. Let's go ahead and have some fun. When it's your first time getting adjusted, I like to do a mild to moderate adjustment. I don't want you to be restricted and tight, so we're going to go light. We're not going to do the big adjustments that you see on TikTok or Instagram. Not yet, at least. So I'm going to ask you to take a big breath in and all the way out. I'm going to use some gradual pressure, and just like that. You see, it's not a big, heavy, scary adjustment. It's very specific, and it's to a specific segment, and instantly the muscle tone is relaxed. But wait, there's more. Go ahead and give me a breath in and out. All the way out. Good. Very gentle. We don't need any more pressure or less. We are trained to find the specific amount of pressure and force to adjust the segment. Next, I'm going to check the CT junction. That's where the cervical spine becomes the thoracic spine, and a lot of times we carry so much tension here. Looking down at a screen, it just builds up. So I'm going to check the motion and just see how's it moving. And right now it feels like it's moving fine, so we will adjust the cervical spine when Kayla is face up. Sometimes patients are really injured and they're not able to move around so well. So I just want to show you there's a modified way we can adjust the low back, and that's by using this drop table where I can push down and then it drops. It creates speed and then a sudden stop to create that adjustment. So I'm going to do that one more time. So if you're thinking at home, I'm not able to twist and turn, here's another way we can adjust the low back. Just like that. Let me have you turn on your side facing me. Now we're going to address the low back. Each adjustment is specific and customized to the patient. No matter your size, your age, there's a way that we can adjust you safely and comfortably. So for most people, about 80% of our patients, we're going to adjust the low back and the hips like this. Now, it seems like Kayla has received an adjustment before, so she's already really well situated, and that's great. What I'm going to do is I'm going to support the shoulder here and bring the knee down. And what that's going to do is open up this area, and it's just ready to rotate. You see, the vertebrae was rotated this way, and we need to bring it back that way. So I'm going to bring it over. Go ahead and turn your head that way for me. Give me a breath in and out. Good. There it goes. And make sure we didn't leave anything behind. Other direction, please. So the adjustment usually just takes 5 minutes, but it takes a lot of time, maybe hours, to figure out, is this patient a candidate for an adjustment? Where do we adjust? When? And how often? So that actually leads me to another common question. How often do you need to see the chiropractor? Well, it depends on if this is an acute condition, a chronic condition. Do you have any a significant medical history or not? Go ahead and give me a breath in and out. Good. There you go. And then lastly, face up. So I'm going to focus on the spine. We can also adjust the extremities, the shoulders, elbows, wrists, hips, knees, and feet. But getting back to how often do you see the chiropractor? If you're a wellness patient, or perhaps somebody who just wants to prevent any arthritis or other chronic conditions, well, a lot of people come in either once a week, twice a month, or once a month. That's the average frequency people will come if they do not have any correction that needs to take place, like if you didn't just have a car accident or sciatica or whiplash injury. Next, we're going to adjust the cervical spine. This is everyone's favorite, right? You're not nervous about getting your neck adjusted, right? Good. But actually, most people are, and I want to assure you this is one of the safest forms of medicine. There's more than one way to address a condition of the spine. For example, a disc bulge. It's not just a misalignment of a vertebrae. In fact, let me show you here. This is a disc, and with compression, it can push that disc bulge right onto that nerve. That's got to be painful, causing sciatica, nerve pain. So when we have a compressed disc, what do we want to do? Decompress it. We want to create a negative pressure to draw that disc material back in on itself, rehydrate the disc, and make us a little bit taller. And that's what we're doing here with this spinal decompression table. It's non-surgical spinal decompression. So we have our patient hooked up here so that this machine can pull, creating that negative pressure. Now we have it set up custom for Kayla so that it's pulling 80 pounds and then 40 pounds, 80, 50. And it's creating this imbibition, it's creating this pumping mechanism to rehydrate the disc and basically take the pressure off the nerve so she can heal, feel better, get out of pain, get into balance, and back to play. That's what we do here. So this is chiropractic. There's many ways to help heal, and it starts with the nervous system, the master controller of the body. How do you find a chiropractor near you? First, start with referrals. Ask your friends and family who already have an established relationship with a chiropractor. Otherwise, go online and look at reviews. The reviews don't lie. You can tell a real review from a fake review. And ask questions. Ask them, what's your intake process like? Do you accept my insurance? Now, I do have to warn you, although many insurance companies cover chiropractic, it doesn't cover everything we need. So sadly, I have to tell patients, remember, your body doesn't know what type of insurance you have. Now the good news is, we know in modern medicine how effective chiropractic is, and that's why the insurance companies are paying for chiropractic, although some of the benefits are limited. Nonetheless, we know we're saving lives with the opioid crisis. We know that we can prevent people from going to urgent care. The number one reason people go to urgent care is low back pain. Why not do something conservative by seeing a chiropractor first? So I'm Dr. Daniel Hoover. This is one part in a series on integrative medicine and how we tie these Eastern and Western practices without the use of drugs and surgery so you can truly get out of pain, into balance, and back to play. Thank you. See you next time.